I'm Randy Neiswonger. Welcome to this episode of Community Beat. Today I have the distinct pleasure of welcoming Dr. Bhatti. Dr. Bhatti, hi.
Hi, thank you for having me.
Thank you for coming. Do you mind telling the audience a little bit about what you do here at Community Hospital?
Sure. I'm a non-invasive cardiologist. I rotate on patients in the hospital, in our ICUs, and see patients in clinic as well. I also specialize in echo and nuclear cardiology.
Thank you, Dr. Bhatti. This Friday is National Wear Red Day, February 3rd. Can you tell us a little bit about the significance of National Wear Red Day?
Sure. The significance of National Wear Red Day, the goal is to help raise awareness in cardiovascular disease in women. It is the leading cause of death in women worldwide. You know, oftentimes women, they prioritize their obtaining their mammogram and pap smears and other screening tests, but it's just as important, if not more important, to make sure that you get screened for your cardiovascular health as well.
That's very significant. Number one leading cause of death in women in the world.
Yes.
Quite an amazing statistics.
Yes.
So, if I were a woman watching this,
yes.
What are the signs and symptoms? I understand there's a difference between men and women sometimes on typical and atypical presentation of cardiovascular disease. Can you talk through that a little bit?
Yes. Most of our studies that we've done regarding medications and that treat cardiovascular disease, a lot of these are done in men. Majority of the patients enrolled in those studies are men. So we don't actually have a lot of data on how cardiac disease presents in women. So women do often present atypically. The classic story is, crushing chest pain radiating down my arm. However, women, while they may have chest pain, oftentimes they have indigestion, nausea, vomiting, a pain between their shoulder blades. And sometimes the atypical nature of the presentation of cardiovascular disease in women often leads to them not being diagnosed appropriately with either a heart attack or other acute coronary process. And this oftentimes also leads to women being treated less aggressively with medication or interventional procedures or surgical procedures that would help improve their cardiac health.
How scary is that? Some people that wouldn't actually anticipate what their signs and symptoms are. I know classically we always think about, like you said, that crushing chest pain, clenching, but in a women, it's much different, is what you just articulated.
It is much different, and it is very scary. Honestly, I've had patients, or I've seen patients that were initially misdiagnosed, but eventually they were given appropriate care. But I think this all highlights the need to promote awareness in cardiovascular disease in women, that it does present differently. Women have different risk factors that disproportionately affect women more so than men. For example, inflammatory diseases, rheumatoid arthritis, scleroderma, lupus, these all raise the risk of cardiovascular disease in women. Another important thing to remember is that diseases such as preeclampsia, like having hypertension in pregnancy or during pregnancy, these patients are at a 75% more risk of developing cardiovascular disease down the road than someone who did not experience that complication.
Well, I now know the importance of National Wear Red Day. It is significant, and
yes.
I think the awareness is very welcomed. As a consumer of this video, and
yes.
perhaps someone that has awareness of their health,
yes.
how can women reduce their risk factors associated to cardiovascular disease?
Well, I think the first step is establishing good primary care and knowing and being appropriately referred to a cardiologist when needed. The other thing that's really important for women is just to be an advocate for yourself. Oftentimes women rationalize their symptoms. Oh, it's nothing, it's just gas, it's just indigestion, where it may be something much more dangerous. And making sure you get your lipids checked, your cholesterol checked, being screened for diabetes, managing your blood pressure, these are all vital steps in promoting good cardiovascular health.
I think that vigilance that you talked about early on when we talk about women's health, regardless of their disease or their disease process, I think when you look at their annual screenings and things that they are very aware about, also including the lipids, the blood pressure, as you suggest, is
just as vital, if not more so.
Yeah. So Community Hospital and in our health system, we're an accredited chest pain center.
That's correct.
Can you talk through what that means to those that are watching this video?
Yeah, all our hospitals, like you said, are chest pain accredited centers. This means that we are fully equipped from the basic non-invasive methods of treating cardiac disease with medication, ultrasounds, echocardiograms, coronary CTAs, but we also provide tertiary level of service. So that includes interventional procedures, surgical procedures, procedures that treat cardiac rhythm abnormalities. We pretty much from A to Z are fully equipped to manage any level of acute care.
I think it's reassuring for our community, our friends, family, and neighbors to know that, like, if they come here with any sort of cardiovascular disease, we're ready for them.
We can handle it. Yes.
We can handle it.
Yeah.
I appreciate that statement.
Yeah.
Thank you so much, Dr.
You're
Bhatti,
welcome.
for joining me.
Thank you
Excellent.
for having me.
And we'll see you guys next week on Community B.